We've created this short film for patients and their relatives who have been told that they will be admitted to the intensive care unit after having an operation in our hospital. It will also be of benefit to patients and their families who have recently been admitted to the unit. The intensive care unit is at Gate 37 on level 2 of the Brunel building at Southmead. It's a specialised area of the hospital that cares for patients who either require very close monitoring and support after a significant operation, who are admitted as emergencies with life-threatening conditions. The intensive care unit has higher staffing levels than normal wards, with one nurse to every 1 or 2 patients and doctors present on the unit at all times. We also have an extended specialist team, including pharmacists, physiotherapists and dietitians. If your operation is planned in advance, one of the intensive care nurses will try and visit you before the operation to explain what will happen when you reach intensive care and answer any questions that you may have. After your operation is finished, you will either be woken up from your anaesthetic whilst in the recovery area in theatres, or sometimes you may be taken to the ICU whilst still asleep and then awoken later. When you arrive in your bed space, one of the nursing staff will be present to look after you all the time, day and night, asleep or awake. They are never far away and are happy to answer any questions or discuss any worries you may have. All bed spaces have a call bell, and the unlikely event you cannot see one of the nursing staff, then please do not hesitate to press the bell and request help. The ICU does all the things you would expect of a normal ward, as well as carrying out specialised patient monitoring and treatments. There are often lots of machines and monitors with all their associated beeps and alarms. It can seem like a lot to take in, and your nurse can explain more about the environment if you wish. All patients have basic monitoring such as a heart monitor, a probe on your finger measuring your oxygen levels, and a blood pressure cuff. You may also have some drips and lines such as a catheter to drain urine away and a nasogastric tube to allow drainage of the stomach, or to allow us to give you medicine straight into the stomach. The ICU team is led by the ICU consultant, and they will see you twice daily to review your progress. In addition, you should also be seen by the team who performed your surgery. Depending on your progress, you may also be seen by a physiotherapist. Keeping as mobile as possible after your surgery is extremely important for your recovery. Even deep breathing exercises whilst in bed can make a huge difference. The nursing team are very active and work hard to ensure you are comfortable and that you recover your independence and are mobile as soon as possible. Visiting time on the unit is from 10 AM to 10 PM, with a usual maximum of 2 visitors at the bedside at one time. If your relatives or friends are at your bedside when care needs to be given, then you may be asked to leave for a while. There are phones in each of the patient's room that can receive direct incoming calls, so your relatives can ring and see how you're getting on. When the team looking after your plans to admit you to the ICU, for example, after a big operation, in the majority of cases, it's not because you are really unwell, but because we know that patients benefit from closer supervision and care immediately after major surgery. Most patients who are admitted to the ICU in this planned way only need high level of care for 24 hours to 48 hours and can then be moved to a normal ward elsewhere in the hospital. Your individual progress will be closely monitored by the ICU team and a decision made with you about when this move is suitable. We hope this video has been useful and has answered some of the questions you may have had about your upcoming surgery. We also hope it might have allayed some of the worry that inevitably goes with having surgery. If you have any questions, please contact the intensive care unit in Southmead Hospital.